Good afternoon, all of you, especially the media persons who are interested to know about golden hours of stroke in related to the brain. You have heard a lot about golden hours, both for the heart and of course heart attacks and how to resuscitate. Now I would like to talk few things about the golden hours, which is related to the brain stroke. Now, just to give a brief idea about the stroke, its burden and its prevalence, it is one of the major public health problem, particularly in Asian countries. As you are all aware, there is a lot of changes that are taking place in the Asian countries. Countries are transforming themselves from underdeveloped countries to developed countries. So during this process of transformation, there are a lot of changes that are taking place individually as well as a whole in the society. So this has resulted in many changes in terms of healthcare also. Stroke is one of such things which have really taken a major share in these changes of lifestyle, especially because of increased life expectancy. We do see a lot of elderly population. Along with seeing the elderly population, we also started to see a lot of elderly related medical problems. And one of the important elderly related medical problems is a stroke, brain stroke. And there is a increased awareness about the healthcare for most of the people, especially after 50. You would have seen everybody's worried about their health and they try to take care of their health as much as possible, which we never used to see about 10, 15 years before. Nobody used to bother about their health and their physical fitness, etc. And as the number of elderly population is increasing over 65, stroke incidence also is getting more and more. 72% of all strokes occur in people over the age of 65. And to give a global outlook about the stroke, about 15 million non-fatal, meaning the stroke which does not kill, occur in each year in the whole of the world. And it is the second leading cause of death in the world. And 5 million each year develop stroke-related problems, and 5 million die out of 15 million, and another 5 million will be disabled. And risk of stroke increases with the age, starting from anywhere from 55 to 60 years, and the highest risk will be around the age of 75 to 85. And incidents vary all over the world. In Russia, for example, it is 388 per 1 lakh, whereas in China it is 247, whereas in Fiji and Italy it is less because of their lifestyle changes. What is the impact of the stroke? Each year we diagnose all over the world about 750,000 of new strokes, not the old strokes. And every 45 seconds, someone suffers from stroke all over the world, if you count. And every three minutes, somebody dies from stroke, if you look at the world scenario. And it is the second leading cause all over the world for death related. And it is one of the most leading medical problem for long-term disability. And this is just to give an example of Asian countries take the burden of stroke to the tune of almost 80 to 85% compared to the whole world population of stroke. Coming to scenario in India, brain stroke is the third largest killer in India. And at a given point of time, there is 40 to 270 people with stroke per 1 lakh. And every year, 130 new strokes are diagnosed, and nearly 70% occur after 50 years. So 50 or 55 is usually the cutoff age. From then onwards, the incidence of stroke becomes more and more. And one important thing I want to emphasize for all of you, hypertension or high blood pressure is the most common risk factor for majority of the stroke. And as I mentioned, what are the causes for increased incidence of stroke in India? sorry for the mistake, in India it is increase in life expectancy, because you know that about 10 to 15 years back, our life expectancy was about 55 years. Now it is almost reaching to 68 years. That means healthcare has been uh, getting better and better in terms of diagnosis, in terms of management, in terms of expertise, etc. That is why people live longer. The longer they live, the lifestyle or elderly related medical issues also become more. And changing demography, why this sort of non-infective medical problems are increasing? Because of various reasons: food habits, sedentary type of work, stress, etc. All these things count for the increase in incidence. And there is a change of lifestyle over the last 10 to 15 years, which has made all these lifestyle related medical problems, especially neurological problems, more common. So especially the youngsters, the rising stress and work-life balance imbalance is the major cause for many of these things. Now, if you look at this chart, it is the if you assess a patients who have stroke after 7 years, about 70, nearly 70, will have some impairment of work. So that means they would have not completely improved. Some significant number, that is 70% is a significant number. About 30 requires some amount of help in day-to-day care, and about 20 requires walking assistance, and about 16 will be permanently admitted in nursing homes or hospitals. So this is the scenario if you look at the stroke pattern in the past. And I want to emphasize one thing for all of you: stroke is preventable, as against the concept most of the public think that it is not preventable. It is preventable to the extent of 75 to 80% to take care properly the risk factors. And it is treatable. Earlier, till about 25 years, that is 1995, before that, we did not have any regular treatment for the stroke. Everybody who gets a stroke would either get only the exercises and some vitamin tablets. Now, 95 onwards, with the breakthrough clot buster injection, things have changed a lot. And now we are in a very better position to treat most of the strokes, provided the affected persons reach the center in the right time and to the right place. And stroke can be divided into two. Ischemic means blockage related stroke, the hemorrhagic bleeding related stroke, whereas ischemic stroke or blockage related stroke contributes to 80% of the total stroke, whereas bleeding relates to only about 20% of the strokes. And majorly three types: blockage related and hemorrhage or bleeding related. In bleeding, it could be because of the blood coming out of the blood vessels. Other one is busting out of the ballooning of the blood vessel, that is called subarachnoid hemorrhage. As I mentioned, most important risk factors are blood pressure, high blood pressure or hypertension. That amounts to about nearly 70% of the strokes. Other risk factors are elevated cholesterol levels, heart diseases like ischemic heart disease, valve diseases, and irregular heart rhythm called atrial fibrillation. And if somebody has experienced stroke in the past, he himself is more susceptible to get more strokes because of the various risk factors that he accumulates. And obesity is another risk factor. Alcohol intake in excess is another risk factor. Smoking definitely increases 2 to 3 times the risk of having stroke. And in females, if they use oral contraceptive pills which contain a lot of estrogen hormone, they have an increased incidence of stroke as compared to those who don't receive these hormone tablets. Now, there are some controllable risk factors, as I mentioned: overweight, diabetes, etc. All these things are under our control to manage. So if we manage carefully and methodically, we can prevent a good number of strokes in a person. Whereas there are some risk factors which are not modifiable, that age is not modifiable. So anybody who reaches after 50, 55, they are exposed to the risk of stroke, which cannot be modified. Men have a greater chance because of various reasons. African Americans may have more incidence of stroke as a genetic problem as compared to Asians. And diabetes mellitus exposes a person to almost 2 to 4 times risk for development of stroke. And if they have a family history, parents have stroke, about 5% of children also can have stroke in the family. This is a normal blood vessel on to your left side. It looks so clean, the blood flow like this, it's like a tube. Whereas if you look at the right side, it is all, it looks very dirty. The yellow part is all cholesterol deposits, and that area will be rough compared to the smooth area on the left side. When there is a roughening of the surface, the blood contents will stick to the wall, and that is what forms the clot and clogs the blood tube. And coming to the symptoms with which the patient with stroke can come, it can be anything. It depends on which part of the brain that is affected. It can come with something like a confusion. Patient may be appearing confused if there is an involvement of a particular part of the brain, which can be mistaken for a psychiatric problem. It can be brought in an unconscious state when there is a conscious level controlling area is affected. There can be imbalance because of the involvement of balance controlling areas, and falling, sudden loss of power in the limbs can make him fall, and that can be the presentation. And vomiting, if there is an area of stroke in the vicinity of vomiting center. Headache can be there, and you have a patient with sudden hemorrhage or sudden blockage. And when field area is affected, it can come with blindness. These are some few blood tests which we normally do when the patient arrives in emergency. And especially the brain scanning is very important, either CT scan or MRI scan, depending on the availability. And we also assess their heart condition, whether there is any clot coming from the heart. Now, this I wanted to emphasize to you, our media friends, because you are the ones who will be the messengers to spread this to the public. Because by following this simple slogan, we can almost identify 80% of the strokes in a earliest possible time. This was put forth by World Stroke Association in 2009. It is a simple slogan called FAST, fast, very easy to remember. So F is face. If you are talking to somebody, or if in your house or in your surrounding, if you see somebody yesterday and today you see his face is sagging to one side, that can be an indication of acute stroke. And if you see, if you have a doubt, if somebody has got a stroke, just ask them to put both upper limbs straight and see whether arm drifting is there. If one arm is slowly dropping down as compared to other arm, that can be another sign of stroke. And if you are speaking, if somebody is fumbling to get some words, or if he cannot pronounce some words properly, that can be one of the indication of the stroke. And if you see any one of these things, it is a time to act. So you have to quickly, as soon as possible, by whatever modalities, you can transport him to the center where acute stroke can be treated. So this, not only you can remember, please spread this fast to your friends, your family members, your relatives, or anybody that you come across, because now in India, hardly about 20 to 25% of the population, general public, knows about at least one of these. So you can imagine what an ignorance we have as far as this recognition of stroke slogan is concerned, because we have been, the neurologists all over India are struggling to educate the public to know about this fast, so that they can identify their relatives, their friends, and their colleagues who develop acute stroke and get them into the hospital where it can be treated. So you will play a big role in remembering this fast, and by spreading this fast message to all your neighbors, your friends, your family members, so that they get the best of treatment that are available in their vicinity. And when you do this fast slogan and when you apply this, you are almost 80% right in diagnosing stroke. Maybe in 20% you may be wrong because it can be mistaken for something else also. But never mind. Even if you are wrong, it is fine. But if you are right, the person gets the maximum benefit if he reaches the hospital in time. Now, there is, we always say time is brain. The time you lose your brain, because for every minute you delay treatment, almost 1.9 million nerve cells will be lost. So you can imagine which we cannot get back. So that is the urgency with which we have to act in treatment of the acute stroke. Now, this slogan of time is lost, brain is lost has been popularized by World Stroke Organization all over the world to make the public aware that they should not lose even 1 minute, if possible, to reach the center where stroke can be properly managed. Now, this I put this chart to show you that at around 100 minutes after the stroke, we can see that still about 50% neuronal injury occurs. Still another 50% can be saved. Whereas if you pass about 300 minutes or about 4.5 hours, NR means not recoverable. So the injury is maximum and those injured nerves cannot be recovered. So time is a real factor in treating the acute stroke. And this is what happens. Supposing on the left-hand side, the first red dot is a dead tissue when the stroke occurs. That is small, if you can look at that. And the surrounding blue area is an area which can be salvaged, which can be saved if we act and treat properly within short time. Now, but if it is not treated, you can imagine that when you come down to the third picture, the dead tissue has become big and the salvageable tissue is very little. So that is the importance of time in treating the brain stroke. Now, I just want to mention about what is this so-called penumbra. Penumbra is nothing but an area surrounding the dead tissue which can be saved if you act quickly and treat properly. And if this area which can be saved can be damaged further if there is a decrease in the blood flow to that area, if there is an increased blood sugar, if there is a fever, if there is a fits or a seizure at the time of stroke. So if somebody has a stroke, but he also has high blood sugar, he also has very low blood pressure, and he also has fever and seizure, their salvageable tissue will be very little, and that may not be recoverable. Now, this is the timeline which American Academy of Stroke, American Academy of Neurology has put forth for the best possible outcome if you treat acute stroke. It should all get over from 0 minutes to 60 minutes if you want to get the best out of treatment from the available expertise. Now, within 10 minutes, you should be arriving to a center and evaluated by the emergency physician, which is we can't imagine in India because of the various reasons like traffic or non-availability of ambulance, whatever you name it. So this is the best possible thing, but whether it is practical or not, it's a different issue. Whereas in Western countries, they in fact airlift the patients if they find there is a stroke patient, and they don't even hesitate to airlift and get into the nearby hospital. And within 15 minutes, neurologists have to see the patient and take a decision. Everything has to be extremely quick. And within 20 minutes after arrival, the CT scan or MRI should get over, because even in most of the hospitals in Bangalore which treats the stroke, the moment the paramedic who goes to pick up the patient in the ambulance senses that it's a stroke, if he gives a call, the MRI machine will be emptied to keep ready for the patient to come for the MRI, the stroke patient. So that is how it should be. And once the MRI is done, we immediately interpret. Our radiologist will be available immediately. Our neurologist will be available. He will interpret whether it is a bleeding or a blockage stroke. Bleeding stroke has got a different line of treatment, which we are not talking about today. Whereas if it is a blocked ones, we immediately take a decision to treat them. And within 60 minutes, the clot buster injection, which is infused within 60 minutes to get the best possible result out of the treatment. Now, there are 7 steps which they have suggested to quickly do all these things. First, before they arrive to the hospital, the paramedics who go to pick up the patient should be trained to detect whether it is a suggestion of a stroke, and they should not waste any time to dispatch the patient to the nearby stroke center. And as soon as they arrive from the door, the ER emergency doctors will assess, collect the details, and go for an MRI and take a decision and infuse the drug. Now, this is the, as I mentioned, this is the timeline which we should follow to get the maximum benefit of treatment of stroke. Now, we have 3-4 options when the patient arrives to give. Either we can give intravenously the clot buster injection, or directly to the artery, which normally we don't do, but if required, we can give. And sometimes we combine intravenous and intra-arterial also. And if they cannot reach within 3.5 to 4.5 hours, sometimes we go for what is called mechanical removal of the clot, that is called mechanical embolectomy. And it is encouraging to note that significant advances have been taking place in India as well. A lot of centers are now, almost nearly 100 centers are ready to tackle this sort of treatment in most of the big cities. Unfortunately, in the rural areas, it is still not that active. And about 55 centers, now it is even more than that, they do mechanical removal of the clot when the patient reaches within 8 to 12 hours, but cannot reach within 4.5 hours to get the clot buster injection. And earlier initiation of the treatment is the best for the patient to recover. Only challenge what we are facing is that hardly 1 to 3% of all stroke victims receive this important drug, the clot buster, even in well-developed countries like US. And 25% of acute MI patients receive it. You can imagine, patients are so much aware about the acute myocardial or heart attack as compared to the stroke. And mean time of presentation in heart attack is about 3 hours, whereas in stroke it is about 4 to 10 hours. And in stroke, about 24 to 50% of the patients reach within 3 hours. Only half of them reach within 50% time, whereas remaining reach late. Now, IV thrombolysis is the clot buster injection, and almost it should be infused as quickly as possible, as I mentioned, within the 60 minutes, which is called a golden hour from the onset of stroke. And the benefit of this clot buster is time dependent. The most early you give, best outcome. The longer you take, supposing you should not think that there is a 3.5 to 4.5 hours to give. This is a window period. So if we let us give at 4 hours, the benefit is less. But if you have a patient within 10 minutes you give, the benefit is the maximum. That is the meaning of the time duration as far as the IV or intravenous clot buster is concerned. And this attitude has to change. There is no need to rush. It is only stroke. The person who is carrying a person and the stretcher, he says to the ambulance, there is no need to rush. That was the thinking which we used to have about 20 years back. Now everything has changed. We have to make room for the ambulance to carry the stroke patients because there is treatment available. And this last word about the prevention, of course, as you are all aware, same thing which are applicable to the heart attack applies to the brain stroke also. Diet, quit smoking, diabetics management, weight management, exercise, and etc. Thank you.